Okay, very good. Yeah, we stay a little bit in the theme with respect to lunch. Not really lunch, but snacks. So let's see which is the topic of today. It's very good that it's after lunch, so you're not too hungry, the craving level is not too high, and we can perhaps discuss, and your focus might be higher, hopefully. I would like to present one smartphone EMA study today, and it's a bit one line of research that I'm conducting recently about how to reduce unhealthy eating, or in this case, unhealthy snacking behavior, in the line of health psychology and behavioral psychology. Okay. Yes. Okay, so what is the background and what is the starting point of this presentation? Is moment I also start the timer. It's about testing repeated over time self-monitoring. This is a very known technique in behavioral change and behavioral psychologists. It's about self-monitoring, so participant or patient self-monitor their behavior. In this case, we target unhealthy snacking, but can also be transversal behavior, for example, smoking, drinking, or exercise, any type of behavior. And lots of research, really a huge body of research has found recently that repeated self-monitoring behavior doesn't really matter with which method or system you use or you do, help decreasing that behavior, especially if it's pathological or if it's unhealthy. And we want to test the same using a bit of a different approach. So in this case, it's psychological approach and health psychology approach, but also methodological, because we wanted to manipulate the frequency of monitoring and see what happens, how people report their unhealthy snacking, craving, intake, but also other more psychopathology type of variables. And I will show you which one in a second. So a bit the hypothesis was, do participants in the high monitoring condition that we had, I will explain you after how frequently we would assess them. Do they crave and snack less over time compared to participants in a sort of a baseline monitoring conditioning? And so we wanted to see also what is the reactivity to this measurement reactivity to EMA, and to what extent can we push a little bit? So how dense can we assess? And in this study, we manipulate one of the so-called D. In the literature of EMA, there are these 3D: density, depth, and duration. For density is meant the frequency of assessment, so number of prompts per day. Depth is number of items of each prompt. How many questions do you ask? And then duration, of course, number of days, number of weeks. In this study, we manipulate the first one, density. A bit more about the method, the methodological approach. We wanted to start targeting healthy control type of participants, so we isolated females, healthy BMI, this typical age range, not on a professional diet, not pregnant, and snacking at least once a day. That was the inclusion criteria on high caloric snacks. And we had some example, and we defined them in the baseline questionnaire, basically. The duration was 3 weeks of EMA, smartphone EMA. We had 3 conditions: high, medium, and low frequency of assessment, in which we assess always the same. So the variables and the items didn't change. So they were craving degree, craving amount, and snacking amount, always referring to high caloric snacks. And I will show you exactly the formulation of the items, because that's very important. We also introduce a minimum compliance rate of 75% per week. And this is basically an idea to ensure a good data quantity and quality. And we have two approaches between subject and within subject momentary. So we used ANOVA because this was basically the idea was to replicate previous findings that used this approach, but also we wanted to look at the momentary effect. And so we use also network analysis. This is how participants were assessed and at what time they were assessed. They will start all at the same time in the morning, so at 10 a.m., and then the last prompt assessment would occur at 11 in the evening. And each assessment was retrospective. And the interval between each, there was also equidistant. That's very important for the temporal analysis that we do. The times were not fixed. There was a little bit of a jittering. That's a bit technical, but in order to avoid learning effect. These are the EMA items. So you can read, for example, that by craving we meant desire. So since the last peep, how strong was your desire to eat a snack? Craving amount was the same, but in portion size, basically. And then we have a snacking amount. So basically the consumption. We also added two variables to basically assess what is the impact of our, especially the high monitoring condition. We really were interested in what is the level of self-control and stress in that, and whether this would be reported as higher in our manipulation. So these were momentary. So no, sorry, it was all retrospective. So since the last peep, always to keep it all consistent. This is how a little bit it looks like. So it was an EMA study, and we used Avicenna is one of the apps that is available. We have a sort of a disclaimer that snacks refer to high caloric snacks, also to remind participants all the time. This is the first set of questions. So since the last notification, have you desired a snack? Yes, no. There were some categories, some options. We are not interested in the specific categories, but we have this type of data information for additional analysis. This was the craving degree. So we have this VAS scale, and we also have the portion, the amount type of question. If they would choose more than 5, they could specify the amount. Otherwise, more than 5, it's hard to analyze the data set. This was for intake. So there was for the craving and then for intake, the same sort of set of questions. This is a little bit the participant flow. I go a little bit quicker in this methodological part because I'm interested in the results, of course. Since you can see that we started with many participants, we ended up with a few participants. That's due to our exclusion criteria, mostly due to this exclusion criteria, this very strict compliance rate, minimum compliance of 75 per week that we set beforehand. That's debatable. Not everybody uses that, but it ensures good quality and quantity of data in each sort of study phase. This is a little bit the participant characteristics, in which you can see the 3 groups. You don't need to read all the numbers, but you can see the low, the medium, and the high frequency had roughly a bit more than 40 participants per group, which was in line with power analysis. And the take home from this figure is that compliance didn't have an effect. So the effect that I'm going to show you were not due to compliance, a difference in compliance rate. Okay. This is the first type of analysis between subject in which you basically collapsed. It's not the optimal way, but indeed we want to replicate previous studies that use this approach. Each point is basically 7 days, and we merge them together. And you can see the 3 weeks and the 3 conditions in different lines. And you see that the blue is the low, the medium is the red line, and the yellow is the high condition. And what we could replicate and find is basically a decrease over time that you can observe, significant, that you can observe in each of these variables. So we have craving degree, but especially we have the amount type of variables. So craving amount and actual intake, snacking amount. And you can see in different type of visualization. So you have the VAS for craving intensity, desire intensity. Craving amount was always asked as for portion size. And so basically in this set of the results, we could actually quite nicely see that this self-monitoring behavior led or seems to lead to reduce intake and craving over time. And you can also observe that that 2 weeks are also enough to achieve this type of result. That's also quite interesting, this sort of additional variables that we assessed together with the rest. And it was stress that was relatively low, let's say, or acceptable, but quite high level self-reported level of self-control, especially in the high monitoring conditions, so in the most frequent. So they need to have sustained level of high control, of self-control in order to apparently cope with the monitoring, because 9 times per day, including weekends, is quite intense. Network analysis. I don't have time to go into the details, but we use one R package that basically runs multi-level vector autoregressive analysis model. There are three assumptions: multivariate normality, stationarity that can be dealt with detrending if a trend is detected, and variance. For variance, we need to exclude participants for which variables basically didn't vary to a certain degree over time, because that's one of the assumptions. We extracted a contemporaneous type of network, which is within the same time point, so within the same assessment, a temporal, which has a lag effect. So it's basically from the current time point to the next one, and a between subject type of network. This is the, oh, it went a bit shifted, but basically the left was the low frequency, the medium was the middle is the medium, and the right is the high frequency. And you can see that the relationship between variables within the same time point, basically. And a characteristic of that is that we don't see so much differences. We also test statistically these three networks. We don't see so much differences between the frequency of assessment at the same time point, so at the same moment of the day. You can see that there is basically a very nice positive relationship between the eating variable, the snacking variable, so the light yellow, craving degree was positively associated with craving amount, the snacking amount, and on the other hand, the two blue dots, the stress and self-control, was negatively, so the red related, these are partial correlations with each other and with snacking amount. So it doesn't seem to have so much of an effect whether we increase the frequency of monitoring. This is the same, is the backstage of the network effect. So it's basically the individual variability for each effect for the low, medium, and high frequency. When we move to the temporal, this is more interesting because it's basically the core of our results. So there seems to be a lag effect, basically, and in which our high intensity frequency of monitoring leads to more dense or more structured network, basically. So if you move from the left to the right, you see that the network structure get more and more dense, basically. And you can see also the stress level gets higher because we have from, especially for the medium to the high, and we have much more basically relationship and between edges and between edges moving from the low to the high frequency. So that was and this is the same, but it's always the inter-individual variability. Also, another interesting effect is that between subject level, so that we see only the positive relationship between craving amount and snacking amount. And this means that people who on average crave more, they also snacked more on average. And this is the interpretation of the first type of network. In the other two type of network, there is a similar relationship, craving degree, craving amount, snacking amount, but there is also a negative relationship. So it's basically, again, a partial correlation between snack and craving amount, stress and snacking amount, and self-control. So basically, it meant that the higher the stress, the less they snack in the medium. And so you can see basically that stress and self-control come to play more and more in the medium and in the high condition. So what do we conclude from that? That self-monitoring snacking behavior can lead to reduced snacking and craving over time. This effect could be or seems to be accessible within 2 weeks already. High frequency of monitoring and also the medium seems to be a bit burdensome for participants, so it might be not optimal as a sort of manipulation or intervention. And so our conclusion, at least our take-home message, is that in this case, less is more. You can achieve a similar effect with less frequency of monitoring. Yeah, so that was it.
the sake of time, one question from the audience. Has questions?
Thank you for the presentation. I was a bit surprised to see that the stress influenced negatively the amount of snacking we could take. So do you have any interpretation? I would have hypothesized the reverse relationship.
Yeah. Honestly, I'm not very surprised because there is really this double tendency with respect to stress and snacking, especially intake. You could almost divide, looking at the literature, in half the population who responds to stress with eating more or with stop or eating less. So it's true that it's not consistent, this finding, but it's also true that it's, you could basically find this opposite approach many times. Yeah. But yeah, I understand the question.
Okay, thank you, Leonardo.
Can I have a question or is it too less time? Too less time?
If it's quick.
Then only a small question related to your question. So do you think that you found a significant relationship, right, between monitoring and the frequency of monitoring and snacking behavior as reported by the participants? But in my view, they were all healthy students or healthy participants with a healthy rate between 20 and 25, I suggest.
Yes.
But related to stress, we also know that stress has this huge effect in eating behavior. Do you think that there might be any other results if you accounted for, let's say, stress susceptibility differences or weight differences or personality differences, which are seem to be so strongly related to eating behavior? Did you not control for those kind of things?
No.
Do you think that the results could have been otherwise if you did that?
Yeah, of course. Then the study design could be slightly changed because you could take into account as a continuous sort of measure. Imagine you have a score of stress as a psychopathology or a larger BMI range.
For instance, extreme groups, for instance, or different.
Yeah. Honestly, that's also why we didn't do it. I'm not a big fan of grouping. Categorizing people is a bit of putting a label on people. I did a lot in my PhD and I want to take a distance from that, but I think that this is bad. So this group difference can be done also statistically to compare networks, and it has been done, but not much so far has been found. But I agree that by considering a larger BMI range, for example, would be very interesting, and also diagnosis and stuff for sure.
People that diet.
Yes. This was a sort of we wanted to control as much as possible for the effect. So that was an initial, but yeah, it's a very interesting question.
Oh yes, thank you very much, Leonardo.